Let's talk about something that you and I have talked about a lot over the last week and a half, which is the fact that the United States is pretty much mirroring Italy. We're about 10 or so days behind where they are, and their trajectory of how many people have been confirmed cases of this is basically we're following them by about a week and a half. And I want you to take a look at this graph we have right here in front of me. This is the spread of coronavirus in the U.S. There, as of midnight last night, East Coast time, there were 4,466. The most recent count we have now is 5,748, which means the trajectory continues to go straight up. It's going straight up. We haven't even really started this 15 days to bend the curve or flatten the curve program. I guess it started yesterday officially. But this is horrifying because this means pain, suffering, and death in a way that we Americans could control more, but we are not.
That is exactly right, Jake, and it's what I think most people in the public health community are really worried about. Maybe it's human nature to some extent not to pay attention to something until it's smacking you in the face. But I think that's what's happening here. I mean, look, some of the numbers we know the numbers are going to go up because testing is now starting to finally catch up, right? There were 8,200 tests done, I think, over the last day or so. That was the biggest number of tests, I think, done in a single day. 60,000 total now, tests that have been performed. Still far below, many of these other countries. So some of that is going to obviously drive these numbers up. Also, it's 5 days between the time someone's exposed to the time they start to show symptoms on average. So, these numbers are going to be behind the curve there as well. My point is this, Jake. These numbers are just going to continue to go up because it is spreading and because the testing is out there. And if you look at images of Wuhan, images of Hong Kong, images where people were truly actually socially distancing, it's very different than the images, Jake, you were just showing on television from San Francisco. The streets were bare. People were not outside. It wasn't like that forever. It was like that for a couple of weeks because that was the goal, to break the chain of transmission. Again, Jake, I don't think we're taking this seriously. There's a lot of things that need to be done. We need to make sure hospitals are prepared. We need to make sure there's enough breathing machines and ICU beds and overall hospital beds. But the individual responsibility, which is something, again, that we've been talking about for weeks, if not months now, I'm surprised, Jake, at this point still there's a lack of seriousness being given to this. And it worries me, and it worries a lot of the public health officials I've been talking to.
Look, everybody understands if you have a doctor's appointment for an important procedure, you go to the doctor. If you need groceries or else you're not going to be able to survive, you go to the grocery store. But this idea of people rollerblading when this pandemic is going on, the idea of beaches in Florida being filled is outrageous, and it is incredible. First of all, it's ignorant, but it's also selfish because, as you and I have talked about at great length, a lot of people, most people will not die from this. A lot of people will suffer from it and perhaps have lifelong injuries from it. And a lot of people, a minority, but still many, many people are going to die from this. And it's actually the bigger group, the survivors, who are going to carry it and give it to the people who are going to die from it.
Absolutely. We're all in this together. And I think that the narrative, the message I think a lot of people have been hearing is, look, it's not that bad. It's just another flu. Most young, healthy people are going to be just fine. Maybe they haven't really been paying attention to some of these other countries around the world that have been hard hit. Maybe they don't fully realize that they can still transmit this virus and make somebody, a family member, somebody they love, or a total stranger sick from this still. This is a virus. It's, I think, unlike anything that maybe many people in their lifetime have dealt with, certainly to this degree. So, I'm not someone who likes to motivate through fear or inspire through fear, but there's lessons staring us right in the face when it comes to this. And for a country that does so many things well, and I think our public health system at times can do so many things well, right now I think we're woefully underprepared. And I don't know what the talkbacks you and I are going to have next week. I don't know what we're going to be talking about, and I'm a little frightened to sort of think about that right now, Jake.
There have been, by serious medical professionals in England and in the United States, projections that hundreds of thousands of Americans will die from this, if not millions of Americans. Now, I understand there have been a lot of people giving false information out there, including President Trump, although in the last couple days he's completely been striking the right tone and talking about how serious it is, and including a lot of conservative pundits and a lot of people on a different channel talking about how this is just like the flu. But it's not. How bad do you think it's going to be in a month? What are we going to be talking about?
I've really tried to modulate, I've looked at all these models, and I've tried to modulate, I think, things to present things in a way that I think are digestible. But look, I think when people listen to the message coming out of the White House today, which again was a much more distinctive and different tone, you heard the president say, look, stay home. Look, it's bad. These are the president's words after he met with his public health advisors, and they really convinced him of what they were seeing here. It's bad, he said. I think people really need to heed that. Jake, the numbers are I think it's hard to really wrap your mind around what the numbers could be. And I don't, I think maybe it's not helpful at this point to project what those numbers are. But let me just say this, you've heard from many people that 40 to 60% of the nation could be exposed to this virus. 40 to 60% of Americans. And you've heard that the fatality rate of this is 1 to 2%, let's say, and that might be conservative. It's hard to know for sure. But overall, look, you can do the math, and again, this is. I don't want to be alarmist. I want to be very careful here how I'm presenting this. But I think the prevailing message should be that maybe we are still at this inflection point, and if we take heed, and we're not asking people to there's no therapeutic, there's no vaccine. We know that. We're asking people to stay home and not spread the virus. That's what public health officials are saying. Stay home and don't spread this virus. You won't know if you are. It's not like something you're going to feel or see or do intentionally, but it could happen anyway. Stay home and don't spread the virus. I think it's really maybe one of the most important things I've said.
Let's talk about some of the things that the viewers at home right now should be doing. First of all, if you're over 60 or you have an underlying issue in terms of your respiratory system or your immunity system, you should stay home. You should be home. You should not be leaving your house, period. You should not be having people over to your house to socialize, period. You need to be by yourself. You need to protect yourself. If you're married, obviously, with your spouse, but you need to protect yourself. Sanjay, you and I were talking about this yesterday. We both have kids who are home. Schools have been canceled. No play dates. We're not allowing any play dates. What other advice would you give people?
With your own personal hygiene, within your hands end up being a big potential transmitter of this virus. It can stay on your hand. You can touch yourself. You can touch someone else and spread the virus. So making sure your own personal hygiene with regard to hand washing is clear. Every time you touch surfaces, make sure you're wiping surfaces, because again, we know that virus can stick to surfaces. If you're going to visit someone who's vulnerable or elderly, and again, like you said, Jake, you want to really minimize that. I was supposed to visit my own parents who are in their late 70s this past weekend. I did not do that trip. But if you have to, you got to act as if you might be carrying the virus. Act as if you might be carrying the virus. My youngest daughter had her birthday yesterday. We canceled birthday party. It was not an easy discussion to have with an 11-year-old. She understands, but it's the right thing to do. We need to set that example. So there's all these things, that are within our power, and we're in this together. I mean, again, the good news part of this is that it is within our control, I think, to totally change the fate here, or at least alter the fate of what's happening here. Maybe not totally change it, but have an impact on where this thing goes. It's within all of us. How I behave, Jake, affects your health. How you behave affects my health. Never, I think, have we been so dependent on each other, at least not in my lifetime. And we should rise to that occasion, I think.